I'm Diana Falzone with NewsNation. Dr. Marty Makary, the 27th Commissioner of Food and Drugs, joins us now to discuss the first 100 days as Chief of the FDA. Thank you for being here, Dr. Marty. You've had quite an eventful tenure so far.
Yeah, look, we've been busy. We want to modernize the FDA. We want to focus on food. People forget that the F in FDA stands for food. We took action on the petroleum-based artificial food dyes. We want to have a healthier food supply and address the chronic chronic disease epidemic that's really been on the wrong path. We want to modernize the way we approve drugs so that we can have more cures and meaningful treatments for Americans. We're addressing childhood vaping and so many other topics. So our job is to safeguard the public, and I think we can do that a lot more efficiently and a lot better.
You just mentioned about the food supply. The FDA announced in April that they are working on phasing out all petroleum-based synthetic dyes in the United States food supply as part of the Make America Healthy Again Commission. I want to break this down to the basics. What are petroleum-based synthetic dyes, and what popular foods might we find them in?
Well, first of all, there's 1,000 chemicals in the U.S. food supply that are not in the food supply of Europe. And so we're doing an inventory of all of them. And these petroleum-based food dyes, that is artificial food dyes, have been implicated in attention deficit disorder and other problems in the health of children. So we're saying we want to see natural ingredients. We want to see people eat less ultra-processed foods. The dyes make these ultra-processed foods more attractive to young children. And so we've approved now natural dyes from natural ingredients. We're going to approve another one on Monday this coming week. And we want to see a move away from these petroleum-based dyes. We saw already the maker of Skittles announced they're going to get rid of titanium dioxide, another chemical that we'd like to see out of candy. And so we're going to keep going like this. You know, I don't believe our childhood diabetes epidemic is a willpower problem. We've got to look at what we are doing to children.
How can these food dyes hurt our health? And like you said, our children's health, because that's what a lot of these candies are targeted to the kids.
Well, some of them have psychoactive properties that we don't fully appreciate. They're not easy to study. Nobody would suggest injecting half of kids in a trial with a petroleum derivative and then watch what happens over 10 years. We've got enough data points to say, let's err on the side of safety. We've got to listen to patients. We've got to listen to parents when they say, my kid had a lot of bad behavior, aggressive behavior, was diagnosed with ADHD. We cut out all the petroleum artificial dyes from the diet and the kid's behavior improved. That's a data point. It's not a randomized control trial, but when you have enough of those, and you do have some good, robust medical studies in the literature, we can take action. We don't need to let the industry tell us what to do. We can do what's common sense. What
about chronic illness? You're working with the NIH and partnering together to do this research to see how these, how the food chain can affect children's development. When we talk about chronic illness, are you looking to see if there's a root cause for inflammation from the kinds of foods we eat? What are you looking for? What do you expect to get from this research?
Well, first of all, Diana, we are working in total synchrony in the Trump administration across all the health agencies. That means I talk to Mehmet Oz at CMS almost every day about how we can design payments to incentivize health and promote new devices and new drugs that can actually replace other burdensome treatments. I talked to Jay Bhattacharya at the NIH about areas where we need to do root cause research. Nobody has been looking at the root causes of why sperm counts are down 50% in the last half century, why 40% of kids have a chronic disease, why 1 in 6 to 1 in 7 girls born today will be diagnosed with an autoimmune disease at some point. We have got to start talking about the root causes. That is, we've got to talk about school lunch programs, not just putting every 6-year-old kid on Ozempic. We've got to talk about environmental exposures that cause cancer, not just the chemo to treat it. So we're taking a holistic view of health, and we're doing that with incredible teamwork led by Bobby Kennedy.
And with the phasing out of these artificial food dyes, where does it stand now? When are the companies expected to stop putting artificial food dyes in their products? And what if they don't? What are the potential implications for them?
Well, look, I think you win more bees with honey than you do with fire. And I think we're starting off with a very diplomatic approach, making this request on behalf of the public. Remember, this is a very popular issue among parents in the United States. Over 90% of parents want to see these petroleum-based food dyes removed from the food supply of children. Republican, Democrat, independent moms showed up in high numbers to vote for this administration on this very issue. So we are seeing tremendous partnership with the food manufacturers, Kraft Heinz, with Danone, with many companies. We're talking to all of them right now, and we're seeing incredible pledges to actually do this in the time frame that's reasonable. Because look, these companies don't want to deal with a patchwork of state bans on artificial food dyes. They want to deal with a national standard and a national time frame, so there's a level playing field with their competitors.
You mentioned that there's going to be an announcement of a new natural dye. What can you tell us what that is?
Yeah, so on Monday, we're going to announce a new natural dye that is from natural ingredients. I can't say what it is now, but we've been doing this every few weeks, and we're going to keep going. We want to see people use whole ingredients. People ask me, what do I need to do to be healthier? And I'd say some basic, simple things. Drink water instead of these sugary drinks, and eat foods that you cook. Eat foods that come from the ground or come from farms, and not ultra pre-processed foods. And these are some basic things we need to incorporate in the new nutrition guidance. The food pyramid has done tremendous damage. It's come from, embarrassingly, the government, and it's done a tremendous amount of damage. It was written by the industry, not based on what's healthy for you, but based on what they wanted you to buy. And we're redoing that guidance. There's nothing wrong with natural saturated fats for the vast majority of Americans. And so we've got to change our focus to the chemicals in the food supply and the ultra-processed foods that's now 70% of the diet of children.
Another initiative that you've been working on is phasing out animal testing, where artificial intelligence will be utilized. Can you explain in layman's terms how this will work?
Well, first of all, the animal testing that is used to predict toxicity in humans is not a very good model. As a matter of fact, 90% of the drugs that pass animal testing end up having a problem in humans with either safety or efficacy. So computational modeling now, that is the computer analyzing a molecule, can predict toxicity as good or better than the animal models in some cases now. So we're advancing that. Also testing drugs on a cell culture in a laboratory called organ-on-a-chip technology. We just had a big workshop on this here at the FDA on Monday. We don't believe that animals were put on planet Earth by God for us to test and torture and abuse. We can find alternatives to animal testing for the vast majority of the requirements for animal testing, and so we have a roadmap to get there.
That's very promising. And yes, no one wants to see animals get hurt. Prior to becoming head of the FDA, you worked at Johns Hopkins University School of Medicine, where you were a surgical oncologist and were the chief of eye slit transplant surgery. You wrote a book, Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health, examining the perceived cracks in the medical field. You address the theory that estrogen replacement therapy is linked to breast cancer and how it could be a mistake to not give estrogen replacement to those who need it due to things like menopause, whether that was chemical, surgical, or natural menopause. Can you elaborate on this?
Well, hormone replacement therapy, that is estrogen or estrogen plus progesterone, when started within 10 years of the onset of perimenopause, can have tremendous health benefits, not just in the short term with relieving hot flashes and difficulty sleeping and weight gain and mood swings, but also long-term health outcomes, reducing osteoporosis and reducing cognitive decline, even Alzheimer's long term, and reducing the risk of fatal heart attacks. These are tremendous health benefits, but sadly, 50 million women have been denied hormone therapy or not offered it because of a study in 2002 that suggested it increases the risk of dying of breast cancer, when that actual study did not show an increase in breast cancer mortality, and subsequent studies have not shown an increase in breast cancer mortality. There's no clinical trial that shows hormone therapy, when started within 10 years of the onset of perimenopause, increases breast cancer mortality. And so we're going to convene experts to talk about the latest evidence, address the dogma, and ask what can we be doing at the FDA regarding the current warning label on the drug that it increases the risk of breast cancer.
And you're going to be doing this at an upcoming Menopause Roundtable on July 17th that is open virtually to the public. What is your goal for this menopause discussion?
Look, we want to hear from the experts. We believe in following the science, and they're going to have a robust discussion. We're doing it public because we want people to learn and listen, and we're doing a lot of things public. Today, we're announcing that we're releasing all of our decision letters for drugs at the FDA. So if a company submits a drug application and we reject it, you're going to see that rejection letter online. So companies won't be spinning the results, and other drug makers and inventors can see how the FDA thinks, what we want in a drug approval, and it's going to increase transparency. So that's part of our radical transparency agenda, and we're going to keep going on this stuff. We need to streamline the regulatory process for drugs, for devices, for new technologies. We want to see more cures and meaningful treatments for the American public and more powerful diagnostics like the continuous glucose monitors that people wear to understand how their pancreas responds to sugar and what gives them a sugar high and what doesn't give them a sugar high in their diet. So we're going to keep going.
Okay. The New York Times, in a piece out this week, cited Robert Califf, who served as commissioner of the FDA before retiring for the agency in January, cautioned that the FDA is being dismantled by the new administration. And he said, history will see this as a huge mistake. The FDA, as we've known it, is finished. What is your reaction to Califf?
Well, look, the FDA is strong, and the FDA is going to continue to be strong. The trains are running on time. We have targets to get decisions out on all of our products, and we're going to meet all of our targets this year. Look, change is never easy, and I understand that. We've got a tremendous workforce here at the FDA, incredible people that I'm getting to know every day. And there was some disruption that occurred just before I came into office. We had 12 travel offices. We had hundreds of people doing the same work in a sort of fiefdom culture that were duplicating services. We had dozens of sort of chief strategy officers. And so we have consolidated a lot of the non-scientific, non-core mission services. For example, we had nearly 2,000 HR people and budget and procurement staff. So there's been consolidation. We've had some reinstatements, and we're hiring scientists and scientific reviewers, even though none of them were laid off. No inspector or scientific reviewer was laid off. We did have change, and I think we're trying to make sure that we can heal well and continue to be strong. And I'm convinced the FDA is going to continue to be strong.
Well, thank you so much for joining us on your 100th day in office. It's great to have you here, and I hope that you'll join us again.
Absolutely. Thanks, Diana.
For health news, go to newsnationnow.com.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.